Hello everyone and welcome to Know Your Drug, the ultimate destination for all things of health and wellness from the fascinating world of pharmaceuticals. We are here to guide you on Clonazepam Tablet, exploring the various aspects of clonazepam, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of Clonazepam Tablet. Clonazepam is a medication that belongs to a class of drugs called benzodiazepines. Here are some common uses of clonazepam. In treatment of anxiety disorders, clonazepam is often prescribed to manage anxiety disorders such as generalized anxiety disorder, panic disorder, and social anxiety disorder. It helps reduce excessive worry, restlessness, and other symptoms of anxiety. In treatment of seizure disorders, clonazepam is used as an anticonvulsant to treat certain types of seizures, including absence seizures, myoclonic seizures, and akinetic seizures. It can help control abnormal electrical activity in the brain that leads to seizures. In treatment of panic attacks, clonazepam is effective in reducing the frequency and severity of panic attacks. It can provide rapid relief during acute panic episodes. In treatment of insomnia, clonazepam may be prescribed for short-term use to help with sleep disturbances and insomnia. However, due to the risk of dependence and tolerance, it's generally not recommended for long-term use in treating insomnia. In treatment of muscle spasms, clonazepam can be used to relieve muscle spasms and spasticity caused by conditions such as multiple sclerosis and other neurological disorders. Dosage of Clonazepam Tablet. The appropriate dosage of clonazepam can vary depending on the specific medical condition being treated, the individual's response to the medication, and other factors. Dosages are typically tailored to each patient's needs and may be adjusted over time. Here are some general guidelines for clonazepam dosages. For anxiety disorders, the starting dosage is 0.25 to 0.5 milligrams taken 2 or 3 times daily. The dosage may be gradually increased as needed, usually not exceeding 4 milligrams per day. Dosage for panic disorder may require higher doses up to 4 milligrams per day. For seizure disorders, the starting dosage is usually 1.5 milligrams per day, divided into 3 doses. The dosage may be adjusted based on the individual's response, typically ranging from 2 to 10 milligrams per day, divided into multiple doses. For muscle spasms and spasticity, the dosage can vary widely depending on the severity of symptoms and the underlying condition. Typical starting doses may range from 1 to 2 milligrams per day, divided into multiple doses. Dosages may be increased gradually based on the response and tolerance, usually not exceeding 20 milligrams per day. Do not make any changes to your clonazepam dosage without consulting your doctor. If you have concerns about your medication or dosage, discuss them with your healthcare provider. Mechanism of action of Clonazepam Tablet. Clonazepam is a benzodiazepine medication, and its mechanism of action involves enhancing the activity of a neurotransmitter called gamma-aminobutyric acid in the brain. GABA is an inhibitory neurotransmitter that plays a crucial role in regulating brain activity by reducing the excitability of neurons. Clonazepam's effects on the GABA system contribute to its therapeutic effects in treating anxiety, seizures, and other conditions. Here's how clonazepam works. GABA receptor activation. Clonazepam binds to specific sites on GABA receptors, which are protein complexes located on the surface of neurons in the brain. GABA receptors have multiple subunits, and their arrangement contributes to the diverse effects of benzodiazepines. Enhanced GABAergic inhibition. When clonazepam binds to GABA receptors, it increases the binding affinity of GABA for its receptor sites. This enhances the inhibitory effects of GABA, leading to an increased influx of chloride ions into neurons. The influx of chloride ions hyperpolarizes the neuron's membrane, making it less likely to generate an action potential. This overall inhibitory effect helps calm the overactivity of neurons, reducing anxiety and preventing seizures. Anxiolytic effect. By enhancing the inhibitory actions of GABA, clonazepam reduces the overall excitability of the brain. This results in a calming and anxiolytic effect, making it effective in treating anxiety disorders. Anticonvulsant effect. Clonazepam's enhancement of GABAergic inhibition helps stabilize the electrical activity in the brain, making it effective in preventing and reducing seizures. Muscle relaxant and sedative effects. The increased inhibitory activity in the brain can also lead to muscle relaxation and sedation, which can be beneficial for conditions involving muscle spasms and insomnia. Side effects of clonazepam tablet. Clonazepam, like other benzodiazepine medications, can cause a range of side effects. Common side effects of clonazepam may include sedation and drowsiness, impaired coordination, memory and cognitive impairment, fatigue, muscle weakness, dizziness, mood changes, digestive issues, increased salivation, tolerance and dependence, paradoxical reactions, allergic reaction. It's important to report any unusual or severe side effects to your healthcare provider. Important advices for using clonazepam tablet. When using clonazepam, it's important to follow your healthcare provider's instructions and guidelines to ensure safe and effective use. Here are some important pieces of advice for using clonazepam tablets. Take clonazepam exactly as prescribed by your healthcare provider. Do not take more or less than the recommended dosage, and do not alter the dosing schedule without consulting your doctor. Attend all scheduled appointments with your healthcare provider for monitoring and dose adjustments if necessary. Your doctor will assess your progress and make any needed changes to your treatment plan. Clonazepam can enhance the sedative effects of alcohol and other central nervous system depressants. Avoid consuming alcohol or using other sedative medications while taking clonazepam to prevent excessive sedation, drowsiness, and potential interactions. Clonazepam can impair your coordination, reflexes, and alertness. Avoid driving, operating heavy machinery, or engaging in activities that require mental alertness until you know how clonazepam affects you. Excessive caffeine consumption can counteract the sedative effects of clonazepam. It's advisable to moderate your caffeine intake. If your doctor decides to discontinue clonazepam, it's essential to gradually taper off the medication under their guidance. Abruptly stopping benzodiazepines can lead to withdrawal symptoms. Do not stop or adjust your clonazepam dosage without consulting your healthcare provider. Sudden changes in dosage can lead to withdrawal symptoms or recurrence of symptoms. Inform your healthcare provider about your complete medical history, including any past or current medical conditions, allergies, or other medications you are taking. This information will help your doctor make informed decisions about your treatment. If you are pregnant, planning to become pregnant, or breastfeeding, discuss the risks and benefits of using clonazepam with your doctor. The medication may pose risks to a developing fetus or a nursing infant. Be aware of potential side effects and report any unusual or severe reactions to your healthcare provider promptly. Pay particular attention to changes in mood, behavior, or unusual thought. Clonazepam is prescribed for your specific condition, and it should not be shared with others, even if they have similar symptoms. Store clonazepam tablets at room temperature, away from moisture and heat. Keep them out of reach of children and pets. Remember, clonazepam should only be used under the supervision of a qualified healthcare provider who can assess your individual needs and monitor your progress. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for taking clonazepam tablet. Remember, knowledge is power, and being well-informed empowers you to make the best decisions for your health.